Schistosomiasis, also known as bilharzia, is an acute and chronic disease caused by a parasitic worm that is transmitted by certain types of freshwater snails. It is considered one of the neglected tropical diseases. Why does it matter? Schistosomiasis is a significant cause of morbidity and mainly affects poor populations, thus further impairing poor health and development outcomes. On the Zanzibar Islands in Tanzania, urogenital schistosomiasis had a big impact on public health in the last century. However, great progress has been made in the control of morbidity, and today the Zanzibar Ministry of Health is committed to eliminating urogenital schistosomiasis from the islands. Over the past 15 years, Pemba Island has been home to different research studies aiming to assess the impact of interventions for schistosomiasis elimination. These research studies were implemented by the Public Health Laboratory Ivo de Carneri in close collaboration with the Zanzibar Ministry of Health, the Swiss Tropical and Public Health Institute, and other partners. For example, the recent Schistobreak study aimed to assess new tools and strategies for schistosomiasis elimination in the north of Pemba Island from 2020 to 2024.
Pemba is an island and it's very hilly and valleys. So with that feature, we have a lot of water bodies within the island, and it's throughout the islands. Some of the water bodies are already infected, and the kids are swimming and playing there. Or of course, the possibility of being infected with schistosomiasis is very high. And also don't forget that there are mothers and women who are also washing their clothes and utensils also in these water bodies, so they have direct contact with the water, and that's a high risk for contacting schisto.
It's more than 10 years now that PHL, IDC and Swiss TPH collaborate, and that personally I come to Pemba to conduct the elimination research against schistosomiasis. What we do is, together with the teams here, is to implement interventions against schistosomiasis, which means that we implement interventions, for example, mass treatment together with the NTD control team from the Ministry of Health, or snail control or behavior change interventions, that we conduct surveys to assess the impact of these interventions in the laboratory here. And we work a lot in the field with the teams really to implement interventions.
In this Schistobreak project, we have done annual cross-sectional parasitological surveys in schools and in communities. In the schools, we have always selected the largest primary school in each small administrative area. And there we have randomly selected children to also have an equal balance between female and male participants, and all throughout all ages. And we have always had 25 children per class, and we also asked them to give us a urine sample, which then later on in the laboratory of the Public Health Laboratory Ivo de Carneri in Pemba was tested with two different diagnostic methods for Schistosoma hematobium or schistosomiasis. And in the communities, we have randomly selected households in each communities, where we then went and invited all household members to participate in our surveys. And one household member always answered also a couple of questions, and then also gave us urine samples, which then equally to the schools were tested in the laboratories for Schistosoma hematobium.
Pale ambapo tunakuta kuna maambukizi ama kwenye kijiji au kwenye shule, tunapeleka team yetu kwenda kuchukua mkojo. Mkojo ule unaletwa moja kwa moja maabara ya afya ya jamii iliyopo Wawi. Tuna njia mbili ambazo tunatumia. Njia ya kwanza tunatumia hemastic. Njia ya pili tunatumia filtration. Tunatumia hemastic kujua je, mkojo una damu ama hauna. Baada ya kuangalia hilo, tunaangalia kwa filtration. Watoto wadogo mara nyingi wakitoka damu kwenye mkojo wanakuwa na maambukizi ya kichocho. Lakini watu wazima wanaweza kuwa na damu lakini ikawa hawana kichocho kwa sababu nyingine binafsi. Kwa hiyo hapa ndipo panapotufanya sisi kupata uhakika wa zaidi kwa kutumia filtration.
In Pemba, 3 key interventions have been instrumental in combating schistosomiasis over the past decades. Treatment with the drug praziquantel, behavior change communication in schools and communities, and control of the intermediate host snail in water bodies. For treatment, the Zanzibar Ministry of Health, in collaboration with organizations like Unlimited Health from the United Kingdom, provided praziquantel to all school children and community members at least once per year over the last 10 years. This preventive chemotherapy aims to cure infected individuals and reduce the spread of the disease. The annual mass drug administration is supported by dedicated community members who distribute the medication locally.
Yule ambaye kwamba anastahiki kupewa dawa kwa ule umri wake, tunakuwa tuna vipimo, tepu zinakuwepo, tunakuwa tunawapima. Katika kuwapima zile tepu, ile tepu kulingana na umri wa yule ambaye kwamba tunahitaji kumlisha dawa inaonesha vidonge vingapi anahitaji kupewa. Ndio hapo tunamlisha dawa vile vidonge husika.
Mimi binafsi nimeshawahi kuugua kichocho, nilipata kichocho mwaka 2023. Dalili niliyopata kwenye kuugua kichocho, nilihisi maumivu wakati wa kukojoa. Mkojo wangu ukawa mwekundu na maumivu kama ya tumbo na unyongojevu wa mwili.
Human behavior plays a central role in transmission and prevention of schistosomiasis. Therefore, together with the communities, scientists have developed interventions to promote a change of behavior in populations at risk of infection to reduce their water contact, improve sanitation, and increase treatment compliance.
When we want to tell people to change their behavior, this means you have to give them another alternative, like don't go to the river, do this instead. We develop the outdoor activity that children learning when they play with the message inside, such as skipping rope, tug of war, poem, and also we have a specific day in school.
Just recently we made a movie which is a story about a boy that has schistosomiasis, and this movie was based on the fact that we went to the communities and asked them, what would you like to learn and how would you like to learn it? And then the idea of the movie came up, and the movie was made based on informations we got from the community. So they told us, we would like to see a movie that is XYZ minutes long, we would like to see this content in the movie, we would like to watch it at specific places, and based on this information we created the movie. So I think this was a very nice example on how we took information we got from the community and turned it into something with which we can then in the long run support the communities.
Snails control includes the use of chemical, biological, or environmental measures to reduce the number of intermediate host snails that are infected with the schistosoma parasite. When there are less infected snails, also transmission of the parasite to humans is reduced and less people get infected.
Prevalence is less than 2% up to now, but we still have some areas which are still hotspot and they are above 3%. And based on that, we still need to continue with surveillance and continue with the education to the community, snail control and treatment. This is very important because in order to sustain and maintain the current situation and probably going to the next step of elimination, we need to do that. In addition, also, we need to consider having a stronger means of diagnosis, because now the prevalence is very low, so diagnostic needs much more modern and technology that will allow us to diagnose schisto even in a very low prevalence.
The Zanzibar Island could be one of the first areas in sub-Saharan Africa to reach elimination of urogenital schistosomiasis. Great progress has been made in the control and elimination over the past decades, and the health of people in Zanzibar has significantly improved. However, the last mile to the full interruption of schistosoma transmission is the hardest part. Complete elimination of urogenital schistosomiasis in Zanzibar can only be achieved when interventions such as treatment, behavior change communication, and snail control are implemented and maintained with high coverage. The infrastructure for health, education, water, and environment need to be improved and aligned with the schistosomiasis elimination goals. Communities should be involved in implementing, using, and maintaining these interventions and infrastructure. High-quality research is needed to prove the interventions and infrastructure, work and speed up the elimination process. Collaboration is key to success. Let us all work together to achieve a Zanzibar free of urogenital schistosomiasis.